discuss about the case study on bitemporal hemianopia with my partner Joy Camille Sanico. Bitemporal hemianopia indicates pituitary tumor by GLO3 ODRPH. Bi means two, temporal means the side of the head, hemi means half, and anopia means visual field defect. Let's proceed to the history of the patient, a 41-year-old black female. Ang reason of visit is for reading glasses. Given this patient age and gender, she most likely has a pituitary tumor causing compression of the optic chiasm resulting in bitemporal defect. An FDT visual field screening is done routinely to all the patient, and in this case, it reveals that bitemporal hemianopia is present. As you can see, mamani ang eye sa patient, bilateral because both man ang nagsuffer ng temporal side sa patient, kining dark side mani ang temporal sa patient. And this is due to tumor nga nitubo sa optic chiasm, which is ang optic chiasm is responsible for the periphery vision of the patient or kining side. Let's proceed sa diagnosis. Diagnosis, as with any patient who's present with a newly diagnosed neurological field defect, the first step is to order imaging or the MRI of brain and orbits. In general, non-glaucomatous neurological visual field defects are bilateral and respects the vertical midline. Balik ta sa picture. Hemianopia respecting the vertical meridian, this one, vertical meridian, because of the tumor that disturbing the optic chiasm or the post-chiasmal visual pathway. So, di na siya mo go further anak na line, like here lang specifically kani nasa picture, nara lang taman sa temporal and sa pikas po di ara taman, di na namula pa sa midline. And this will lead to impaired peripheral vision in the outer temporal halves of the visual field of each eye. Mauna na in this case, order an MRI of the brain and the orbits. If aneurysm is suspected, schedule an MRA to evaluate the arteries of the brain. Joy Camille will further discuss the treatment of bilateral hemianopia. Thank you.
So that was Bea Rafosala for the case history and diagnosis of our patient. So now let's proceed with the treatment and management. So after MRI was done, it was confirmed that the patient has large benign pituitary tumor. So she was referred to a neurosurgeon for its removal or treatment of the pituitary tumor. And it will be expected that the patient will still have eye follow-up checkups to check if there is if the treatment done was effective or there was in terms of the vision. And if after doing all the necessary steps such as removal and treatment, there is still a permanent functional visual field defect, then the doctors will have to consider using prisms to compensate for her visual field defect, bitemporal hemianopia. So now let's proceed with the discussion. So lately, optometrists has made it a point to give patients a regular visual field screening so that visual field defects will be detected early on and to give a better prognosis for visual recovery. So if a problem is found before the optic chiasm, so if this is the optic chiasm, so before in the number 1, it usually results to a unilateral visual field defect. So this means that only one eye is affected. So in our case, only the right eye is affected. So if there is a lesion or problem found at the optic chiasm or at this part, number 2, so it usually results to a bitemporal hemianopia. So why is it bitemporal? So now let's focus on this part, on the nerve fibers that pass or that cross through this optic chiasm. So we can see that the nasal side, which is represented by this green colored fiber, and the red colored fiber at the right eye. So this green colored fiber, or the nasal side of the left eye, focuses on the or processes the temporal view of the patient's left eye, and the red fiber focuses on the temporal view of the patient's right eye. So if there is a problem, or there is, let's say, a compression of the chiasm because of a pituitary tumor, such as in our case, a meningioma or a metastasis, so it usually results to a bitemporal hemianopia. And if a lesion is found after the optic chiasm, so let's say in this number 4, it usually results to a homonymous hemianopia. So homonymous meaning same side. So why is it same side? So you can see that the nerve fibers are represented with the yellow and red colored colors. And in the yellow colored nerve fiber, or the temporal side of the left eye's retina, it processes the nasal view of the left eye, and the red fiber processes the temporal view of the right eye. So meaning only the right side of both eyes are affected by this lesion or this defect. So in our case, there was a compression of the chiasm, which resulted to a bitemporal hemianopia, and hemianopia because it respects the vertical midline, so it doesn't cross. It's always half. The defect is usually half. So that's it for our case study report, and that case study is the case number 3 in this article reference below. So that would be all. Thank you.